Right, good morning all and welcome to this webinar as part of our South Yorkshire Bitesize series. My name is Gemma Ridley. I am the South Yorkshire Innovation Hub Director. Today's session will be around economic participation and will be covered by a presentation from Rowan Ellis-Hollins at the Yorkshire Cancer Centre and Helen Ross from Sheffield Hallam University. We'll then wrap up the session with a question and answer part of the webinar as well. So these webinars are part of a series that highlight research and innovation best practice from across South Yorkshire and have been running since September, and this is our penultimate one, so we're nearly there with them. Each month is focused on a different theme. So far we've had cancer, children and young peoples, prevention, workforce, and this final series, which is around economic participation. So in line with the 10-year plan, we wanted to maintain the energy around innovation as a national priority, because we all know innovation drives progress, it enhances problem solving and fosters growth, which will forever support our health and care industry. So we hope that you feel inspired by our speakers, you gain insight into the research and innovation delivery system, and you can take away tips to use in your local workplace as well. So to begin with, I'm just going to run through a couple of house rules and reminders. So we'll be recording this session today and it'll be uploaded onto the South Yorkshire Innovation Hub website, which I'll pop in the chat in a moment. You'll notice as you've joined, your camera and your mics will be kept off just for the sake of bandwidth, etc. So we don't all end up getting kicked out halfway through. So if you do have any questions or comments, please do put them in the chat or use the question and answer facility at the top of your screen. And we want these sessions to be quite interactive. So we're going to use polls as we go through. And to test that and to test my IT skills as well, I'm just going to launch the first poll asking around why did you join today? So it will just flash up on your screen, and if you can just take 2 seconds to answer that for me, that would be fantastic. But they will all be in the chat afterwards as well. So if you don't get to it immediately, you can come back to it. Lots of curiosity and hearing of best practice, which is grand. Thank you. So thanks for filling that in. I'm now going to pass you over to our speakers, Rowan and Helen, and they'll share more about cancer research across South Yorkshire. Thanks.
Thanks, Gemma. I'll just quickly introduce myself and let Helen introduce herself too. So I'm Rowan, the Public Affairs Officer at Yorkshire Cancer Research.
And I'm Helen Ross, I'm Sustainability Manager for Active Together South Yorkshire, and I'm also a physio by background.
So I'll start by giving a brief introduction to the charity and then pass on to Helen to talk to you about Active Together in South Yorkshire. Next slide, please. Oh, actually, next slide again. People in Yorkshire are more likely to get cancer and more likely to die from cancer than almost anywhere in England. When we look at some of the headline data for cancer in Yorkshire, we see that Yorkshire typically has higher rates than the national average and of most other areas in England. There tends to be a race to the bottom between Yorkshire, the northwest and the northeast, basically anywhere north of the M62 corridor. Yorkshire is also home to pockets of both high and low levels of rurality, deprivation and ethnic minority populations, meaning there is also significant variation in access, risk factors and outcomes across the region of Yorkshire itself. Next slide. Thanks. Yorkshire Cancer Research exists so that people can live longer, healthier lives free of cancer. Essentially, we want to fund more clinical research in Yorkshire, deliver services that are backed by research and evidence, support the region to be more research active, ensure research and services are designed and delivered to people across Yorkshire, and that people affected by cancer can shape our work. The next slide shows a snapshot of our funding portfolio since 2015. The charity has committed £91 million across 105 different projects, including 44 clinical trials, and involving 1,180 experts and 710 patients and members of the public. One of the key ways that the charity measures its impact is through estimating the number of life years gained our work may lead to. Life years gained is the number of years of life added due to an avoided death or extended life as a result of receiving a treatment or intervention. Research and service awards to date are estimated to give an estimated 10,325 more years of life. This does not account for the additional estimated impact from those yet to take part in live awards. And many of these life years gained will come from the charity's drive to give more people access to prehabilitation and rehabilitation services following a cancer diagnosis. I'll now pass on to Helen, who will tell you a little bit more about this.
Thank you, Rowan. Yorkshire Cancer Research have generously funded Active Together services across Yorkshire, and you can see them here on this map. Today I'll talk to you a little bit more about the services in South Yorkshire, as this is more of a South Yorkshire forum. So Active Together South Yorkshire is a cancer prehabilitation and rehabilitation service. We started seeing patients in February 2022, and we've now received just shy of 3,000 patient referrals across South Yorkshire. Active Together is multimodal, and it comprises of physical activity, dietetics and psychological support as the three main components, and behaviour change is a fundamental part of the service. The service is for patients receiving cancer treatment at one of the 4 acute trusts in South Yorkshire, and we therefore have Active Together services set up in Barnsley, Doncaster, Rotherham and Sheffield. And we very much link up with the leisure sector to deliver across different venues in the different localities to ensure that the service is local at the point of need. Active Together is very much a collaborative service which began in Sheffield and was developed by Sheffield Hallam University, delivered in collaboration with Sheffield Teaching Hospitals and funded by Yorkshire Cancer Research. Active Together started with referrals received for upper GI, lung and colorectal patients, and since then has expanded into other tumour sites. The service is for patients with curative intent, and this curative treatment may be surgical and or non-surgical in nature. Active Together provides support that spans the rehabilitation continuum and reflects the current evidence base through 4 phases, which are prehabilitation, maintenance rehabilitation, restorative rehabilitation, and the supportive phase. The service receives blanket referrals from CNS colleagues at the point where the decision to treat is made. The assessments at the beginning of prehab and at the beginning of the restorative rehabilitation always include a complex needs assessment and outcome measure completion to ensure that personalised care is always delivered. And these assessments help to determine how the patient is triaged for ongoing prehab or rehab. And we have a range of accessible options for patients, including one-to-one sessions, group classes that are either face-to-face or virtual, open gym floor sessions, well-being and healthy eating workshops, to name a few. And just considering how this pathway fits in with the evidence, so we know that cancer and its treatment can cause great harm, and we can see from the graph here at the bottom that this can lead to a significant decline in health and function. What we are wanting to achieve is by patients having that opportunity for prehab, this will better prepare individuals for treatment so that they can get through their treatment better. And then with a period of rehabilitation after treatment, the patient's health will improve to or above their baseline level and beyond. And this slide just highlights that individualised and personalised care aspect and shows again how patients are triaged at their initial assessment and then again at post-treatment across the 3 modalities into specialist, targeted and universal. And I've mentioned that behaviour change is embedded in all that we do, and with that all staff receive training as part of an Active Together training and development programme that we've delivered and developed, which includes motivational interviewing and behaviour change techniques to ensure that every contact counts. And we're really fortunate that alongside the running of the service, there is also an evaluation by Sheffield Hallam University. And the second evaluation report is actually due for publication later this year. But the first evaluation was published in autumn 2024, and I'm just going to share with you some of the findings from that first report. So the first evaluation was completed with data collected between January 2022 and April 2024, which was before that regional expansion across South Yorkshire, but it therefore includes patients eligible for the Active Together Sheffield service who were receiving treatment at Sheffield Teaching Hospitals. During that time frame, the data included the first 3 tumour groups that the service started seeing, which were colorectal, upper GI and lung cancer patients. At that point, the service had received 847 appropriate referrals, and 81% of patients accepted the offer of the service, which is higher than comparable services for cardiac and pulmonary rehab programmes. And 43% of patients came from areas with the highest levels of deprivation. And there has been excellent patient engagement with the service, with a 92% appointment attendance rate, and patient experience is very, very positive. From a patient perspective, 97% of patients reported improvements in their health and well-being as a result of Active Together, and interviews demonstrated that patients felt more confident and more in control of their health. Other benefits frequently noted by patients included an improved knowledge of physical activity, increased energy levels, reduced fatigue, and helping others to feel less worried. And this highlights the service's effectiveness in empowering individuals to take ownership of their physical and mental well-being during the challenging experience of cancer and its treatment. One patient said, "It gave me the confidence to get my physical health back to what it was pre-cancer treatment, which in turn helped my mental health, and my life in general is better." Equally well, a large number of healthcare professionals across various job roles took part in the evaluation and spoke favourably of the Active Together service. 93% agreed that Active Together was very well or extremely well integrated into their cancer pathway, and the referral process was noted as being quick and easy to complete. One clinical nurse specialist said, "Active Together is now embedded into practice, and the dedication that the team have shown while setting up the process has greatly improved our patients' sense of well-being. They feel like they are in an active part of their treatment." So just moving on to have a look at some of the patient outcomes now. So patient feedback and quantitative data highlighted significant improvements in physical fitness. Patients discussed how increased physical function transform their daily lives. And we can show you here for patients within the Active Together service how their aerobic capacity altered as measured and represented by the 6-minute walk test. And hopefully some of you are already thinking that this graph looks similar to the one we discussed earlier and shows that patients' cardiovascular fitness improved from baseline after prehabilitation. It dropped off after cancer treatment and then significantly improved again during rehab to an above baseline level and then beyond into the supportive phase. And this isn't just in isolation, because we also saw a similar pattern for measurements of leg strength, fatigue and quality of life. This graph shows the dietetic needs of patients throughout their cancer journey for each of the 3 tumour groups, and again this follows a similar pattern to the other graphs that we've seen so far. Interventions were aimed at preventing and treating malnutrition, helping patients to manage the side effects of treatment, improve patients' eating habits and maintain healthier weight levels. This supported patients with greater nutritional risks to stabilise their condition and better tolerate treatment, which also highlighted through patient feedback, which spoke of the vital role of dietetic support. And here, moving on to look at mental well-being, just to reassure you, this graph is inverted compared with the previous graphs. We've seen a reduction in score demonstrating reduced levels of anxiety and depression. So from this graph, we can see that patients' mental health and well-being improved during prehab and rehab, with lower levels of anxiety and depression reported compared to baseline. And then we need to take those patient benefits into account to then look at overall Active Together patients spent less time in hospital after surgery and less time in critical care. And these differences are clinically meaningful given the high cost of a hospital bed, and particularly a critical care bed. We are also really aware that there is a cohort of patients who may not have received surgery if they had not improved their fitness through prehab. So this may have affected these results, but is something that will be evaluated further. And based on that hospital stay data, for all 3 tumour groups, there was an average net saving of £366 per patient, or a £1,079 gross saving. There are also likely anticipated broader healthcare and cost benefits of the service that were not captured directly, such as reduced primary healthcare costs, reduced social care costs, and earlier return to work. And we continue to try and quantify these with health economist expertise. And we've just started to work with the Chartered Society of Physiotherapy nationally to help to develop a value calculator for cancer prehabilitation and rehabilitation, which will include these healthcare and cost benefits. And I wanted to share with you this final piece of data, which shows that higher one-year survival rates were observed among Active Together participants compared to non-participants. And this was true across all 3 tumour groups. Going forward, we need to continue to monitor and evaluate the long-term impacts of the service on these survival rates, consider the quality of the survival and also healthcare utilisation to fully understand the benefits and refine the intervention as needed. And as we're now entering this more mature, established service, we want to continue to optimise staffing and premises costs as patient numbers increase and improve cost efficiency. Here are some of the high-level findings of the report, but more importantly, on this slide, there is a QR code that will take you through to the full report so that you can read that at your own leisure. So the evaluation contributes to a growing evidence base surrounding cancer prehabilitation and rehabilitation. And as we continue now to ensure sustainability of the service for our patients in South Yorkshire, it's really important that we consider the national picture. So prehabilitation and rehabilitation is included in strategies, plans and guidance across cancer care, and we are seeing this more and more. On the back of Lord Darcy's review, the new 10-year health plan was released last year with a focus on shifting the system towards prevention and community-based support, and we believe that Active Together reflects these priorities. As a model for community care, it can deliver strategic benefits across South Yorkshire, supporting patients, staff and strengthening local healthcare systems. And we've been working with NHS England to share information and best practice around Active Together and develop a useful resource for national cancer alliances looking to develop their own services, making it clear what cancer prehabilitation and rehabilitation should look like. So I'll just hand over now back to Rowan to take us through the next steps from the charity.
So thanks, Helen. Sorry. Here are our planned next steps for Active Together, which include working with ICBs and cancer alliances to roll the service out across Yorkshire and continuing research to refine and evaluate the current service, as well as looking into the potential of a service for survivors of childhood cancer. And finally, we hope that prehabilitation and rehabilitation will be integrated within the National Cancer Plan, which I'll talk a bit about now. Over the last 3 years, Yorkshire Cancer Research has substantially increased our public affairs activity, with the aim of influencing national and regional cancer-related policy. One of the ways we've approached this is through the publication of the White Rose Cancer Report, which you can see on the screen. The report gives a snapshot of known problems in Yorkshire, along with 4 clear recommendations, all grounded in academic literature and backed by evidence generated by the charity. Our recommendations align with the government's ambition for the National Cancer Plan to focus on prevention, early diagnosis, timely access to treatment, personalised care, and fair access to research and innovation. One of these recommendations was that multimodal prehabilitation and rehabilitation is embedded in NHS cancer care as standard across the country, ensuring all patients get support with exercise, nutrition, and well-being before, during, and after treatment. This recommendation was based on the compelling evidence from the Active Together services and experiences of Active Together participants like Karen, who featured as a case study in our report, as well as global evidence that cancer exercise treatment reduces the risk of death and lowers the risk of cancer returning. We launched this report at a roundtable event in Westminster in June, and a couple of weeks later held a regional launch at the AWRC, which was hosted by South Yorkshire Mayor Oliver Coppard. Across those events, shining a spotlight on prehabilitation and rehabilitation and really showcasing Active Together has been one of the main aims. Around those launches, we've been lobbying MPs, peers and ministers to support the recommendations within the report. And at the same time, we launched a public-facing campaign, encouraging members of the public to lend their support to the recommendations. We're very pleased that more than 2,500 people signed up to support the campaign, and the names of all those supporters were presented to Ashley Dalton, one of the health ministers, in October. We firmly believe that cancer prehabilitation and rehabilitation is part of the future of cancer treatment, and the model of Active Together aligns particularly well with the national priorities around moving from hospital to community and from treatment to prevention. and South Yorkshire has been a trailblazer for this impactful and innovative programme. We are expecting the National Cancer Plan to be published on World Cancer Day, which is the 4th of February, and hope to see a commitment to pre-rehabilitation and rehabilitation within it. We are very pleased that South Yorkshire ICB and Yorkshire Cancer Research have agreed to put forward a joint proposal for funding Active Together until 2031. We know that this is an agreement in principle and will continue to work closely with the Cancer Alliance to ascertain next steps. Thank you so much for having us today, and please do ask any questions.
Wonderful, thanks guys. That's hugely informative, and I'm actually quite blown away by some of the statistics in that. Before we launch into the Q&A, I'm just going to flash up another couple of polls for attendees to fill in. This will also give you a couple of minutes to think on questions for Rowan and Helen. So our first poll is around, did you learn something new from this presentation? No, I certainly did. And everybody did. Wonderful. Thank you so much. And just the next one is around how helpful you found the presentation. Again, really helpful for me. It's got my brain whirring about all sorts of things that we could do together in the future. And then finally, just a question around how this links into your current work priorities. Okay. Wonderful, thanks so much. If you didn't get a chance to, I know I closed those polls down quickly. If you want to go back into the chat, you can do. Before we launch into the Q&A, I think for me, one of the things that struck me, Helen, I know we met back in 2024, but the progress this has made since then, and the impact this has made is just really stark. I know my mum went through cancer treatment, unfortunately, and she passed away in 2023. But the physical nature and the access to physical exercise was absolutely, restorative for her as we went through. What do you think? And I think successes are really striking. I don't want to be a Debbie Downer, but what have some of the challenges been to putting this in place? Like, what are some of those learnings that you could share with the group?
Yeah, there's been so many benefits of working as a collaborative unit. So like the acute trusts, Yorkshire Cancer Research, and then the university, loads of benefits, but it definitely does still have its challenges. And I think a lot of that is trying to understand the system. So we started seeing patients and Active Together when the CCGs were still in place. I think in that summertime, then the ICBs were developed. The ICB then went through a restructure. And then furthermore, as we know, sort of the ICBs are currently going through another restructure now. So for us, trying to understand the correct stakeholders, trying to get people together around the table who we need to have the conversations with to try and get a regional service commissioned has been challenging at times. But we have worked so closely with our Cancer Alliance in South Yorkshire and Bassetlaw and received so much support from them that again has been really positive on the back of trying to understand who we need to talk to, who we need to engage with, and the processes involved with future commissioning.
Mm-hmm. Yeah, absolutely. I think that partnership approach is something that's come out from all of the Bitesize webinars that we've done, that it's critical that we work together. So we had a question that popped up in the chat as we were going. So do patients, oh, one sec, it's gone off. I was reading and it disappeared. Do patients need their doctor's referral to access Active Together? And are all patients in the identified groups eligible?
So the referrals come from the clinical nurse specialists within the acute hospital trust. That's where we get the referrals from currently. And yeah, as long as patients have a curative diagnosis and are for active treatment, then we can accept those patients into the service. And we very much say to our CNS colleagues in the hospital, please refer everybody who that is for, like who has that curative diagnosis. And then through our assessment process, because we've got those stratified levels of need, we've got the specialist targeted and universal, then the therapists within the service will then be able to work out a personalised treatment plan for that patient going forward. So we try and say send everybody as long as they're curative, and within those tumour groups that obviously we're accepting referrals for currently.
Grand. Just a note in the chat from Tracy saying thanks to everyone, but she had to leave, but that's fine. I think one question for me is around that messaging, and obviously, you know, the acceptance rate from being referred into that, but also those stats around reaching every level of our communities. What have been some of the, I suppose, have you linked in with voluntary groups to be able to spread the message about that this is available? How have you sort of engaged the community, our voluntary sector and our communities around that this service is here?
Well, I think Yorkshire Cancer Research have done an awful lot in sort of talking at that high level to sort of politicians and like that White Rose report and things like that. I think on a more ICB level, we talk to anybody and everybody who'll listen to us, really. We have spoken to voluntary organisations. We link in particularly with those voluntary organisations for people from a mental wellbeing. So we've got like Macmillan, we've got Western Park Cancer Charity, Cavendish, the Well for Wellbeing in Barnsley, etc., etc. But then also we work very closely with the leisure sector across the ICB, so we work with Doncaster Culture and Leisure Trust, Everyone Active, Places for People, and with Barnsley Premier Leisure as well. So that's another network of services that can extend our reach as well. And yeah, talking at conferences, you guys have been really great in supporting us from the Health Innovations Network and sort of getting our message out there. And then we also have comms and marketing sort of engagement officers within the service as well, who are employed by Yorkshire Cancer Research. So again, it's just making sure that we're joining up the dots, reaching out to everybody that we can do and trying to get the message out there, both locally and nationally.
Yeah, absolutely. It takes a village, doesn't it, when these sort of programs are in. So we've no other questions that have come up in the chat. So before I close this, we have two final polls, which are just our evaluation polls. This one pops up in the form of a word cloud. So what will you do with the information you've heard today? Again, feel free to tap into this now or go back into the chat and fill that in. And I know there's a few people I recognise a few names on the call, so this is a given. But would you attend another bite-sized session in the future? We're currently thinking about how we'll do these sessions again as we go into the next financial year. So if they've been useful, please do let us know, as this is really useful for us. Wonderful, 100%. Right, looks like we're doing them again. Wonderful. So that's brought us to the end of the session. Thanks again to Rowan and Helen for presenting today. Like I said, all the bite-sized webinars have been recorded. They're on the South Yorkshire Innovation Hub website, and the link is in the chat if you just scroll up. So please feel free to share these with your colleagues and watch back. We have one session left if you want to join that one. Again, that's on our website, so please do have a look at that. But thank you so much for spending your valuable time with us today, and we'll see you at a future session. Thank you.